Kia ora tātou. Thank you very much, Jenny. And could I, at the beginning, congratulate you, Jenny, and Jim as the director of this wonderful health challenge. It's got a very important mission, and I'm sure it will contribute enormously to the health and well-being of all New Zealanders. And talking about the global NCD crisis, I just want to put to one side our branding problem. We all know what NCD stands for. People outside this room don't have a clue. So when we talk about NCDs, we have to get to the situation when we talk about KFC, when we talk about HIV/AIDS. We know exactly what that means, even if we don't actually remember HIV/AIDS, what they stand for. So it's a problem that, and the ministry talks about long-term conditions. I tried very hard, with limited success, when I was at WHO, to change my department from NCDs and health promotion to chronic diseases. And it lasted for about a year until after I left the organisation, then regressed. So I think the problem is we're stuck with this unfortunate label. I think when we're talking to people who are not familiar with it, we should always say heart disease, stroke, diabetes, cancer, just to make sure that people know what we're talking about. Before I talk about the global NCD crisis, I want to just draw our attention to the tremendous progress that has been made in global health generally. Life expectancy for the world has gone up by 10 years in the last 30 years. Tremendous achievement. Deaths of children under the age of 5 have declined in the last 20 years from 10 million to 6 million. And HIV/AIDS deaths now down to under 2 million. A lot of progress. Still many things to do, not least of all the NCD problem. Before I talk about the numbers, I want to personalise this issue. I want to tell you my NCD story. It began in 1965. My father, at the age of 59, died after 7 years of vascular disease. Of course, that was a personal tragedy. It also had an impact on my life more generally. I'm sure the reason I started training as a cardiologist and then very soon stopped, and then went into epidemiology, public health, with an emphasis on the prevention and management of NCDs, was because of his death. The second family death, 2 years ago, my older brother, 76, died of a very complex neurological condition with a strong vascular underpinning. Not from one of the main NCDs, but an NCD, but a condition which many people now link with NCDs. These two family deaths represent the face of NCDs. My father dying of vascular disease 50 years ago is what is happening around the world now. A death at that age in New Zealand now is, of course it still occurs, of course people still survive from those events, but it is very much rarer now than it used to be. In part because we have done so well in the prevention and control of cardiovascular disease in New Zealand. Death rates have plummeted over 60% since the late 1960s. My brother's deaths represent the face of NCDs for our society now and in the future, and as low and middle income countries develop. I'm just going to pause a minute. I want you to personalise NCD. Bring to the forefront of your mind a friend, a relative who's experienced an NCD, perhaps died prematurely, perhaps suffering from it. We're talking about large numbers, we're talking about real people living in real families, in communities. And I would be very surprised if there's a person in this room who couldn't immediately identify their favourite NCD person. So, huge problem, huge numbers. NCDs are now on the global agenda. This occurred in 2011, September 2011. There was a United Nations high-level meeting on NCDs, New York. Only the second time that a health issue had been discussed at that high-level United Nations forum. The first, 2001, HIV/AIDS, of course. How did NCDs, a label, a condition we hardly know what it is, reach the global agenda? Well, it took a long time, 50 or 60 years of evidence building, 30 or 40 years of wisdom building, 10, 15 years of advocacy. The research, of course, going back at least to the Framingham study, very important piece of work done by the World Bank, 1993, World Bank Development Report, the early precursor of the global burden of disease study, for the first time made the point that NCDs were the leading cause of death. Of course, infectious diseases are important. Maternal mortality is important. Child deaths are important. But from that time on, 1993, we knew that the leading causes of death and disability in the world were these NCDs, these four conditions: heart disease, stroke, vascular disease, diabetes, cancer, and chronic respiratory diseases. And then a lot of lobbying, initially from Caribbean countries, Commonwealth countries, and then on the agenda, with WHO playing a leading part in that process. So what was the evidence that led to that high-level meeting, led to us becoming a global issue of concern? Well, of course, the numbers speak for themselves. 56 million deaths every year now, last year. 40 million of those deaths are NCD. 17 million of those deaths are what they call premature, occurring under the age of 70. Some people might take exception to that definition, but that's what's used. 17 million due to cardiovascular disease, 8 million due to cancer, 4 million due to chronic respiratory diseases, just under 2 million due to diabetes. A large contribution to global deaths. And of course, a tremendous contribution too to disability in years of life lived in disability. Big problem. Deaths, disability. Also, it's a huge economic issue. Most people in the world are not covered by decent health systems. We are extremely fortunate in that respect in New Zealand. A stroke in a low and middle income country devastates the individual, devastates the family, leads to poverty. Where there is a functioning health system, the burden of NCDs creates tremendous strains on the health system. When we know what's happening in this country with projected impacts of the diabetes epidemic in this country, for example. It's a development issue. It impacts upon GDP at the country level, and it is actually a very good investment to invest in the prevention and treatment and NCDs, and all countries have much to gain by doing that. So a big problem, large numbers, huge economic costs. The good news, of course, is we know exactly what to do about it. These are preventable conditions in all countries, not least of all, of course, New Zealand. We know the causes, we know the main risk factors, we know the underlying drivers, we know what works, we know that the prevention of smoking, tobacco use causes 6 million early deaths every year around the world. We know exactly how to prevent each one of those smoking deaths. And in some countries are making progress, but our progress is very, very slow, given what we know, what needs to be done. 6 million deaths from tobacco, 8 million deaths from raised blood pressure. We know how to prevent raised blood pressure. There are still populations in the Pacific who do not experience an elevated blood pressure as they age, who are still relatively thin. Not many left, but there are some. We know that physical inactivity is responsible for 3 million deaths every year, air pollution, another 3 million deaths, low fruit and vegetable intake, if we believe the data, responsible for quite a lot of deaths, and so forth. We have all the evidence we need to know about what causes these preventable deaths, and we have interventions that will make a difference on many of them. And of course, from the tobacco point of view, we have WHO's Framework Convention on Tobacco Control, a global treaty with 190 countries now ratified, which indicates their obligations in terms of preventing smoking uptake and helping people stop. The most effective intervention, of course, around tobacco, as on many other conditions, is increasing the price through taxation. And what proportion of the world's population is covered by taxation at the recommended price level, which is 70% of the packet of tobacco? New Zealand, Australia, a few others. 10% of the world's population is exposed to a level of taxation recommended by WHO, and which will have a big impact on smoking rates. Still a lot to be done. So those are the numbers. So how are we doing? What progress are we making? UN high-level meeting, 2011, wonderful declaration. Political declaration, said everything that we in the public health NCD community would have died for. Some of us probably did die for it, actually. And so what's happened? Well, following that meeting, WHO was charged with drawing up a set of targets for the prevention and management of NCDs. And Jim referred to the overall target, 25% reduction in premature mortality from the 4 main NCDs by 2025. And Jim used the word aspirational. I'm not being critical, Jim, you appreciate that. And I saw a smoke-free coalition document yesterday with Richard, which had the 2025 smoke-free target for New Zealand being aspirational. As soon as you start labelling targets aspirational, forget it. So I'll come back to 2025. Jim, the 25% reduction in premature NCD mortality in New Zealand is totally achievable. And the reason that is, I'm absolutely confident in that, is because that target was based on the historical performance of the top performing countries, which New Zealand has won. And if we do nothing, we'll achieve that target. Reducing mortality. We won't have any impact on inequalities, of course, which, are, as you mentioned, and I should emphasise, are just huge for NCDs. And we know quite a lot about what causes them too. So in terms of the 2025 target, high-income countries are on track. Most of the countries in the world are not high-income countries. Low and middle-income countries are going to struggle very hard. And even if they were to achieve the 6 risk factor targets for tobacco, for alcohol, for salt, for obesity and diabetes, for physical inactivity, and for blood pressure, they may not reach there. We have to be, the targets are not ambitious enough for countries which are not on track like New Zealand. So, Jenny, did you mention the SDGs? I did. Thank you. So the next big global event, which was again a big thing for NCDs, women standing at the back, do you have back problems? Yeah, many people consider musculoskeletal disorders to be an NCD, so welcome to the club. And I share your issue. SDGs, sorry. September 2015 agreed, replacing the Millennium Development Goals, for which there was quite a lot of progress in the end, because there was a huge amount of global money spent on NCDs. 17 SDGs in contrast with 8 MDGs. The overall SDG you would die for: to transform our world by ending poverty, protecting the climate, and ensuring prosperity for all. Isn't that wonderful? Especially, well, all of it, all of it. It will cost $50 trillion over the next 10 or 15 years. That's the estimate. One of the 17 targets, target 3, is on health. And this is also good, to ensure health and well-being for all at all ages. These are starting to sound a bit aspirational, actually. And then 3.4 is the NCD target, to reduce premature mortality from NCDs, the 4 main NCDs, by 30% by 2030. That's fine. We can probably do a good part of that. And then it says and to promote mental health and well-being. We get very important, but not quite so quantitatively exposed. So the SDGs are very important. Now, what are the barriers? I want to say just 3 things about the barriers to achieving global progress in NCDs. The usual barriers: political leadership, political will. We have all the documents, all the action plans, all the strategies you could dream of. You could probably fill a room like this with the NCD strategies that are on paper. And political leadership waxes and wanes. And at the moment is it waxing or waning? Not very high. And this program has this healthier challenge. I got it right? Is exactly what we need to, and you hear the Minister speaking, very enthusiastic. Lots of potential for this challenge to encourage political leadership. So political leadership in many poor countries, and we understand there are so many problems, so many issues of the day. And NCDs doesn't necessarily raise up the political agenda. The second issue is we're just not advocating the correct technical interventions. As we see in this country, individual responsibility, freedom of choice, nanny states, you do it. We're not focusing enough on the environment to make it easier for all of us to deal with the causes of NCDs. And money. There isn't a lot of money. I'm not too worried about the money because, you know, if every country put up the tax on tobacco and alcohol and maybe even sugary drinks, there'd be so much money we wouldn't know how to deal with it, so long as it was directed towards childhood obesity or managing tobacco and so forth. We don't earmark money in this country, but some countries do, and there's plenty of scope for earmarking some of the additional taxes raised on unhealthy products to promote health. So that's where we are, mixed progress. New Zealand, we're doing okay, other countries like this. So what is the way forward? What should we be doing? Well, I think we should keep focused. You know, we've got 17 SDGs, 13 health targets, 169 indicators, no, 169 indicators. No country in the world can measure that. We need to focus our priorities. And here we could learn a lot from the Pacific, where Pacific countries have agreed to an NCD roadmap. And the ministers of health of the 22 Pacific countries sat down and agreed with the ministers of finance this roadmap. And they are reviewing progress every year. Progressed a little bit slow, but it's all there. Four priorities. Tobacco, of course. Aspects of diet, particularly sugary drink tax and salt reduction. And then the better management of people at high risk. Critically important. And then there's another more general set of priorities. I think that's what we need to do in this country. We also need to follow, all countries need to follow our obligations to the UN. We've said we'd have a multi-sectoral action plan. We've said we'd have global NCD targets. We've said we'll build on the health system's responses to NCDs, and we've said we'll act more on risk factors. We're doing some of those things very nicely in New Zealand. We're not doing everything. So we need priorities. We need to broaden our scope in dealing with the underlying drivers. And quite a lot of interesting stuff in the papers the last couple of days about what the grocers are going to do in this country. Fine, do it. Measure, publish your results, let's measure it and hold them to account. PepsiCo has said that they're going to do something this morning. Reduce the proportion of their sugary drinks from, by 25%. It's a step in the right direction, not nearly enough. The underlying drivers, particularly in the Pacific where trade is so critically important, is something that we need to focus much more attention on. And the third thing we do, we need to hold our governments, our ministers, accountable. We have to measure progress. We don't always do that very well. We have to monitor progress and review the progress. Then we have to hold to account and make sure that the remedial steps are done. So we need independent accountability. There are some complex systems out there, and there are some simpler systems being proposed for accounting for progress on NCDs. I'm thinking now about my family deaths. I could have added 2 other deaths. I could have added the death of my mother from cancer. I could have added just a recent death in my wife's family, alcoholic liver cirrhosis, dead at 65, nasty death, totally, again, preventable. I could have added my sister who's just had a hip operation this week, doing well, finally. NCDs are all over us. It's a huge problem, in summary, a huge problem, but it's more than a big number. It's people suffering in their daily lives from preventable, manageable conditions. Big problem. We know what to do about it. There is no excuse for not accelerating the global prevention and control of NCDs. And my final point is that we in New Zealand can continue to lead the way in the global prevention and management of NCDs. I'll give you 2 examples of where New Zealand is leading the way. Of course, smoke-free 2025. No other country in the world, well, that's not true. The Pacific has agreed to a tobacco-free Pacific by 2025. No other country in the world has agreed to, has a government agreed to reduce tobacco use by that much. We're not on track. We've got huge inequalities. There's much more we can do. But I feel strongly that it's an achievable target, and I'm going to make every effort to be here in 2025. The other thing that New Zealand has done exceptionally well, and thanks to Rod Jackson's pioneering work, is the management of high-risk people in an efficient and effective manner based on absolute risk. These 2 ideas, if we could just take and implement in the Pacific and then take and implement globally, would make a big difference and do much to prevent NCDs globally and do much to improve the health and well-being of all our fellow citizens. Thank you.